23 die in Norway after receiving Pfizer COVID-19 vaccine, 13 were nursing home patients. According to ANI and Asian news agency, ANSA, the Norwegian Medicines Agency and the National Institute of Public Health registered 23 deaths, including elderly and frail people, associated with anti-COVID vaccination, from Pfizer-BioNtech and announced eventual complications with the vaccine, especially in the elderly patients. Common reactions to mRNA vaccines, such as fever and nausea, may have contributed to a fatal outcome in some frail and elderly patients, it was reported. The note also notes that the vaccine trials did not include patients with acute or unstable disease, and very few over the age of 85. The body that regulates medicine in Norway, the Norwegian Medicines Agency Legemiddelverk, has warned that people over 80 years of age and the terminally ill may be at risk of suffering fatal side effects from the COVID-19 vaccine, the Local Norway online newspaper reported. Reports suggest that common adverse reactions to mRNA vaccines, such as fever and nausea, may have contributed to a fatal outcome in some frail patients, explained Sigurd Hortemo, chief physician at the Norwegian Medicines Agency. In a press release, the Norwegian Medicines Agency stated that as of January 14, 23 deaths had been reported that occurred shortly after receiving the COVID-19 vaccine. Of those deaths, 13 were evaluated and it was concluded that side effects associated with the vaccine may have contributed to severe reactions among the weak and the elderly. As a result, the National Institute of Public Health has updated its COVID-19 vaccination guide with more detailed advice on vaccinating the elderly who are vulnerable. All deaths that occur during the first days of vaccination are carefully evaluated. We cannot rule out that adverse reactions to the vaccine that occur within the first days after vaccination, such as fever and nausea, may contribute to a further course. Serious and fatal outcome in patients with a serious underlying disease, the agency advised. However, it was also noted that in the country's vaccination campaign for older people, many of whom are in nursing homes with serious underlying conditions, deaths are expected to occur near the time of vaccination. According to the agency, an average of 400 Norwegians die each week in nursing homes and long-term care facilities. For those with the most severe frailty, even the relatively mild side effects of the vaccine can have serious consequences, the agency warned. For those who have a very short remaining lifespan anyway, the benefit of the vaccine may be marginal or irrelevant, he said. Vaccination programs have begun around the world to combat the coronavirus, which has killed nearly 2 million worldwide, according to data from Johns Hopkins University. But, Norway's vaccine warning is the most cautious statement yet from a health authority. Pfizer said in a statement that it and BioNTech are working with the Norwegian regulator to investigate the deaths in that country. Last week, the U.S. Centers for Disease Control and Prevention, CDC, announced that allergic reactions to COVID-19 vaccines are relatively rare. The CDC said that of nearly 2 million people who were vaccinated against COVID-19 over a 10-day period in December, only 21 people experienced severe allergic reactions. And it was added that most of those people had a history of allergies or allergic reactions, and that of the 20 people the CDC tracked, all had recovered and been sent home. ANI. Thanks for watching this breaking news video. Please like and subscribe for more relevant stories.